Is there a safe dose of prednisone? Like, is there a dose you can take and be like, ah, I don't have to worry about it. There's no side effects? Well, I'm Dr. Megan, your prednisone pharmacist, and I'm here to explore that question with you today. My goal is to always help you find ways to not just survive prednisone, but thrive well on prednisone. And figure out the right dose is one of those ways. So they did a study, the European League against rheumatological conditions. They did a study to figure out, is there a tolerable dose that people can have the lowest possible risk and the highest possible benefit? And they discovered that for most people with rheumatological conditions, so that's like rheumatoid arthritis, which is often called RA, and other things similar to that, that if a person is taking less than or equal to 5 milligrams, that usually in that situation, the benefits outweigh the risks, that it's a low enough risk that the relief of the inflammation, the pain, the discomfort, the inability to use your hands and things like that is worth it compared to the risks of the side effects. And then over 10 milligrams a day, the risks of side effects in that situation are not worth it. That long-term taking 10 milligrams a day for rheumatoid arthritis is too much, that there's too many side effects and not enough benefits. So that was what they determined for rheumatoid arthritis. But what about between 5 and 10 milligrams a day, right? That was kind of a gap. They said less than 5 is okay and more than 10 is not okay. So between 5 and 10 milligrams, this is what they said. They said patient-specific characteristics such as age, sex, genetic predisposition, comorbidities, co-medication, and lifestyle. Essentially, if there is anything that is increasing your risk for the four most troubling side effects, which they said are bone loss, osteoporosis, hyperglycemia, which can lead to diabetes, cardiovascular disease, heart disease, and infection. If you have something that is increasing your risk for those things, then maybe 5 to 10 milligrams isn't worth it for you. But if you don't have a genetic history for osteoporosis like me, if you don't have a history of family members with diabetes like me, then maybe you'll be okay at that high of a dose. But if I were given prednisone long-term for rheumatoid arthritis, a safe dose for me would not be toward the 10 milligram end. It would be for the 5 milligram end because of my genetic history, my body size and type. But that's always a decision between you and your doctor. So trying to find the lowest dose is the best strategy. In summary, this is the ultimate goal. The lowest possible dose for the shortest duration is the goal to provide the best benefit risk ratio. So if you want to know other ways to get the safest dose for you, to tilt the benefits to risks ratio into your favor, then you need to get the prednisone checklist. On it, I include the top 7 mistakes people make while taking prednisone, top 15 things that you can do to feel better while on prednisone, the top 25 side effects people have from prednisone, and what you can do about each of those to tilt the benefits and risks scale into your favor so that every milligram, every single dose you take is in the best balance possible. Just click the link below to get access to the prednisone checklist so that you can feel well while on prednisone. Signing off as Dr. Megan, your prednisone pharmacist.